Okay, welcome everyone. It's good to see you. I'm thinking a few more people will probably continue to join us, but we do have lots of folks watching the recordings. If they can't make it, I put them on YouTube and then can see how many views they have. So I'm glad to see people are watching, and hello, whether you're watching a recording or live with us. We have a really full agenda today, so I do want to get right to it. I'd like to first ask Connor for a quick update, and then we'll jump into the real nitty-gritty details, exciting things we have to talk about today.
Yeah, thanks, Deanna. So Deanna and I were communicating earlier this week and last week about the annual Senior Center survey, and I confirmed for her that that is certainly something that I'll be able to provide assistance for and manage. So I think the strategy there will be initially working with the VASCAMP steering committee and going through the existing survey that will be replicated from last year, seeing about any additions, seeing about taking anything out, whatever they need in terms of that support. And then from there, we will run the survey, provide the link to everybody, and also make sure that folks have an opportunity, if they need to be able to print it out and mail it back to me. So keep an eye out for those details in the next few weeks, as I anticipate a pretty quick turnaround from the steering committee in terms of what's needed for the survey and any additions or, as I said, limitations to change it from last year. So, and if anybody has any questions, feel free to email me or give me a call. And yeah, I think that was it. So thank you.
Thanks for that quick update, Connor. And as a reminder to everyone, the last 3 surveys, the Senior Center surveys, can be found on the State Unit on Aging website. And they're really helpful information, especially over time. It's been really important to have that information about what senior centers are doing. And we've learned each year, and this year have some ideas for questions that will help us with some of the funding projects that we're working on as well. So with that, it's a great segue to turn it over to Jane, who will talk about what we've been working on together with the VASCAMP Steering Committee and Jane and Mary over the past month since we've last met. So Jane.
Thanks, Deanna. Well, it's been a very busy few weeks, and I'm very happy to report that the earmark, the congressionally directed funds for $600,000 that required an application to the ACL to really define the scope of work and the really get into some of the details around what the senator had approved, was submitted successfully on the morning of June 30th, which was the day of the deadline. Many thanks to the steering committee here at VASCAMP, working with Mary and myself and other folks at AgeWell who put some time and effort into the work plan. So just to let you know what was involved, and it was a learning opportunity for all of us, really. But as the senator approves these earmarks, then it gets handed over to the federal agency that's going to manage the funds. And then they have very specific and detailed requirements around applications, form submissions, accountabilities, and certain things that they expect ultimately reporting, but also certain things that we can and cannot spend the funds on. So the overview of these funds really were geared in about 4 different areas. The first one was about $100,000 that was submitted to assist VASCAMP to build out the nonprofit status and the nonprofit entity in the next 12 months or so. So some details went into that, and the project plan, defining the scope of work and how the funds would be spent to do that. The second allocation was $350,000 to support evidence-based programming across the senior center systems. And so what was required of us was to really define how those funds would be spent. There were also some requests, pretty straightforward, coming from the senator too, around expansion of foot clinics. So those were built into the project plans, as well as, so about $175,000 to expand foot clinics across the system. There's also $175,000 that will support different kinds of evidence-based programming across the system as well. And bear in mind that there were no details around how those programs would get stood up necessarily at which sites, just that there would be a number of them supported based on the funding that was available. So that'll be the operational work that will need to be done once everything gets wrapped up. The last $150,000 came from a proposal from the V4A, so the Area Agencies on Aging together, to really set up a CSA-like model to get fresh veggies, fruits, and so on into all 5 regions through collaboration with senior centers or meal sites, depending on how things could work. So again, more details over the next 6 to 8 months or so will be built into the plan. But given that the funds won't start to flow in until August timeframe, which is what I've learned, they will allocate them by quarter. So starting in August and going through, expected through the end of July next year. So the CSA model wouldn't kick off until next spring and be a 16 to 20 week program, likely starting sometime May, June, and working with different farms or farmers doing a CSA in the different regions that would cover the state. So those details, along with budgets that were tied to each of those work plans and implementation plans, were tied together, submitted. There was a cover letter that really outlined the scope of the programs and how they would be managed. And yeah, that was pretty much the bundle, but there was a lot of detail to discuss. Again, thanks to everyone who was so helpful to get some of those particulars figured out, especially around the budgeting and the kinds of resources that would be helpful. So I did receive notification from the ACL that it was accepted, well, not approved. I'm waiting to hear what that looks like, what the next steps are. But they certainly received the submission, which was good. There was no glitches. And I got an email from the grants manager at the ACL just indicating that they are reviewing everything now and they'll keep us posted. So that's what I got.
Hey, thank you so much, Jane. So the things that we've been talking about as a group for months really were how to bring more programs to senior centers and how to support that capacity building. So not just taking on new programs, but actually having some funding to help support our administration of those programs. So those are some of the things that are built into what Jane was talking about, and that centers will be able to apply for to offer evidence-based programs and more foot clinics, do the reminder calls, purchase some technology if you don't have that already, with some technology bundles. And those are some of the details of what is involved in those pieces that Jane was talking about. So as soon as the next steps, happen and everything is approved and we know the application process, we'll share with this whole group how to apply for those funds and what reporting will be required if those funds are awarded. but it's really exciting for senior centers. And we definitely couldn't have done it without Jane and Mary's work on those submissions to the ACL. So we're really grateful for that. Is there any questions on this grant and what we've been talking about before we move to the next piece of the agenda? Okay. I don't see any questions. Good job, Jane, explaining all that. That's good. Okay, so this also ties right into what we were just talking about. Our guest speaker for today is Melissa Southwick. And Melissa is from the Vermont Department of Health, Health Promotion and Disease Prevention. And they have a very cool website that has classes there and things that senior centers could offer in bringing programming to their centers and their older Vermont participants. So we're going to let her talk to us about that, and keeping in mind that these are evidence-based programs, what we were just talking about, having some funding to bring to our centers.
Thank you so much, Deanna, and thank you, Connor, for making that connection. I'm so happy to be here and actually see some familiar faces, which is exciting too. I'm going to try to share my screen, but while I do that, I can give you just a little bit of background about myself. I have worked with older adults in Vermont for the past 20 years as of this month. So I started out as a case manager at the Agency on Aging that's now known as AgeWell, and did that for 12.5 years. And then I moved on to the SASH program, where I was various things within the administration, most recently the director of the program. And now I am at the Department of Health, working on the My Healthy Vermont programs. So I've been in a variety of capacities working with older adults my whole life. And I just love that you have this coalition that meets together and works on senior centers, because I think that's such a pivotal piece of the puzzle for our older adults in Vermont. Okay, so sharing my screen, you should now be able to see my PowerPoint. Can you? Wonderful. That means I can only see some of you, so I apologize for that. And if you need to interrupt me, please just feel free to do so. I have about 10 minutes of information to share with you today. So we know in Vermont that 3 behaviors, no physical activity, poor diet, and tobacco use, lead to 4 diseases: cancer, heart disease and stroke, type 2 diabetes, and lung cancer, which result in 50% of Vermont deaths. And as a result, life-changing programming is available free of charge to many of our patients and our participants. And program completion has a huge impact for the long-term health of participants. These programs are actually offered through the Agency of Human Services funding through the Blueprint. And then the Blueprint, as of last October, contracts with the Vermont Department of Health to work on the oversight of these programs. So this is new to us as of last October, but it fits really well with our mission to help improve chronic diseases throughout the state. These are free to participants through that funding. So other states actually have to either charge people for these programs, or they have to bill insurance. The programs are on average about a $400 value, and we're able to do that for free, which I think is wonderful. I'm going to tell you just there's 6 different programs being offered currently right now, and they're being offered in both a virtual, like this format, or in person, or we have some hybrid models that are trying to happen right now, where we get a group of people together in, like, say, a senior center, and then the actual facilitator is located somewhere else. Maybe 2 senior centers could join together and host at the same time. So we're really exploring ways to get this to people where they are in the way that works for them. So we understand virtual doesn't work for everybody. Diabetes prevention. This program is a year-long class. It meets for an hour each week for the first 16 weeks. And then after that, it tapers off to once a month. People are eligible for this if they're at risk of developing type 2 diabetes. So anyone with a BMI over 25 is eligible to take this program. Attendees learn how to decrease their risk of developing diabetes through healthy eating, getting more physical activity, managing stress, But I think the biggest piece of this program is actually working on action plans, understanding how to create one that works, and then following through with it. There's a level of support that goes throughout the program. I actually took this program for a year, which is what inspired me to move to the Vermont Department of Health to work with these programs. I found it to be very well run. There's diabetes management. This is for people that have already been diagnosed with type 2 diabetes, and it helps people understand how to manage that disease, including managing their stress, maintaining their blood sugars, and other risk of serious health problems related to the condition. This class is 2.5 hours long, and they meet once a week for 6 weeks. High blood pressure management is newish within the last year. It's been being offered within Vermont. It's for people who are aged 45 or older and have been diagnosed with hypertension or high blood pressure. This class runs for 1.5 hours long over 8 weeks. And most of the time, attendees get a free blood pressure cuff that they can either use during the class or take with them after. And they learn the basic of controlling high blood pressure, as well as making healthier choices, reducing stress. And a big piece of this too is also learning how to work with providers around this condition. Quit smoking. This is for people who currently use tobacco of any kind and are looking to quit. The attendees get the support and motivation they need in in small group classes. One-on-one can be done through Vermont Quits, but we offer small group classes. Attendees can receive free patches or gum, lozenges, or fidget tools to help them quit. And the classes vary between 4 weeks or 8 weeks. They're all an hour long, and it really depends on the tobacco treatment specialist and the curriculum that they're using. Chronic pain management is on hold until September, but just because they've updated their curriculum. And so we're currently working to get all of our trained facilitators in the state up to speed on the newest curriculum. This is for people living with chronic pain, so pain that lasts for 3 to 6 months or longer. They learn ways to reduce their pain, deal with stress-related issues, trouble sleeping, and also working with providers and specialists. It's a 2.5 hour long class, and it meets for 6 weeks. And then chronic disease management is for people living with any chronic disease. So arthritis, cancer, obesity, heart disease. Really, truly, if it's a chronic disease, we will let you into the class. We want to help. Attendees learn how to make choices living healthier with chronic diseases by lowering the risk-related health problems, managing stress. They're all a little similar in the way that they approach this. They work with creating action plans and understanding the illness that you're dealing with in order to help manage the provider, but they all focus on a little bit different areas. So we've had people that have taken multiple of these classes because they want to work through their chronic pain, and then once they figure out that, they want to work on their hypertension, and we welcome that. So I want to share this video with you if I can. I'm not sure if I shared the little thing that says to play my sound or not, so if you can't hear it, let me know, and I can try that. It's 2 minutes, but I think it's well worth it. Can you hear it? So, okay, hold on, I might need to figure out why my sound isn't working. I apologize. Let me try to end my share and start again. Oh wait, it's up here. Okay, so let's try sharing again, and this time maybe it'll give me the option to share sound. Yep, perfect. Thank you all for your patience.
For me, it's just connecting with people, hearing their stories, their struggles, their challenges. I'm Becky Best, and I work as a regional program coordinator. The My Healthy VT workshops offer pre-diabetes and also diabetes management workshops. The best part of my day is really connecting with the members of our community and be able to meet them, where they are in their journey. 68% of Vermonters are living with prediabetes. By catching it when it is still in the pre-diabetic phase, you can actually completely reverse the condition of prediabetes.
I go see a doctor like annually, and my primary care doctor always keep an eye on my blood sugar because my father have it and my youngest brother have it. But then 2 years ago, I have another blood.
One more try.
Okay. Well, you know what? I'll send you the link. You can watch it on your own time. It's pretty amazing. I apologize for the technical difficulty, but it really just walks people through how what it looks like to join one of the workshops. And I think that sometimes taking that fear of the unknown out by demonstrating what it looks like is really helpful. The one last thing I wanted to share with you, so I will try to share my screen again, is how you make a referral. So I think for you all, if you would like to host a class at your workshop, you can go about that 2 ways. You can reach out to me, or you can reach out to your regional coordinator, and we'd be happy to coordinate that with you. But if you just have somebody that you think would benefit and you don't really want to bring a whole class to your workshop, I'll show you how to make a referral too. So you should be able to see, and from current slide. Okay, are you able to see my screen?
Yeah.
Okay, so when you go to myhealthyvt.org, this is the website that you're going to see. You would just pick whichever one of these programs you're interested in, and it will give you a list of when the next classes are starting. They start on a rolling rotation, so there's sort of always a class starting. That's our goal anyway. And you would just click this register button. And from there, you would come to this screen. This is an interest sheet. So you would just fill out your name or the participant's name, their email, their zip code, and their phone number, which class they're interested in coming to, and hit send. That will then come to your regional coordinator. So we have someone covering each area of the state that is the person that you would connect with. They're going to be the person that can help get that participant enrolled and help with any kind of tech support that might be needed, give the blood pressure cuffs if that's an issue that they're looking for. And this is also the person that you would connect with if you wanted to host a class, or if you don't know, like when I leave, I can send this to you, but if you don't know who that is, you can always just reach out to me. We'd also like to invite anyone that might be interested to join the My Healthy Vermont Diabetes Coalition meeting. So up until May, this was called STEM, which stood for State Engagement, and did not help anyone understand what the meeting was about. So we rebranded in May, and we're now called the My Healthy Vermont Diabetes Coalition. And so this is just a group of interested stakeholders around the state working to help promote the diabetes prevention courses. You're welcome to join us. The next meeting is July 25th, and I would be happy to send you an invite if you're interested. And then my information is here. It's just melissasouthwick@vermont.gov. I see a typo there. I apologize. But you can reach out to me if you have any questions about any of this, or if you want any of the information that I shared today.
Thank you. I did have one question. I think I'd seen on your website one about emotional health, a sort of a mental health one, and I didn't hear that mentioned. Is that something that's still offered?
It is still being offered right now, though. We're having to retrain all of our people. So this was through the RAP, through the Copeland Center, and it's only allowed to be offered in person unless you are at the Copeland Center. So during COVID, we weren't able to hold any of those workshops, and all of our people need to now be retrained. So it's basically on hold until we sort of figure out next steps for that. Great question. Thank you.
Great.
Jane, I see your hand.
Thanks, Melissa. It's really a comment, really. I wanted to let you know that as part of this ACL submission we really pointed to myhealthyvt.gov programming as part of the evidence-based menu. And when Deanna was talking about the bundles of technology, we realized that many of the senior centers can't access easily online programming. So the combination of the free programs, the evidence-based programs, which can really help with health outcomes, and then being able to invest in the technology to, I think it was, correct me if I'm wrong, Deanna, like up to 20 sites, we're going to be able to really drive, I think, some great education and evidence-based programming. So your website was great. I researched it a lot as part of the submission, but super, super cool. And just so excited to learn about it.
Thank you. Any questions I'm happy to answer, but we do find that the website's really pretty easy. There's actually this pre-diabetes risk score that you can take. It's just you click through these 6 questions and that can help you know if you're eligible for the pre-diabetes class. All of the workshops that we offer are evidence-based. And I know that you all were talking about funding through the grant, but we also have funding on our end too. So I think that we can work together to get these started even like now before you figure out how that grant would work. And if there's a way to fund trained leaders or something like that going forward, that's great. But we've got people sort of ready and waiting to have places to host them. So that's wonderful. And congratulations. That sounds like quite the achievement.
Are there other questions for Melissa about how this works as a class on site or remotely or about anything for Melissa?
I have a question. Hi, Melissa. I'm the director at the Montpelier Senior Activity Center. Just sort of logistical question in a way. I'm curious about, this seems like a fantastic resource and I'm really interested to share it out. And wondering if you have kind of like a, not media toolkit, but like little sort of things that we can share out, I think would be really helpful.
Thank you. That's such a great question. I should actually add it to the slideshow. If you go to myhealthyvermont.org and you click on the section that says for providers, you will see information on how to get posters, how to get wrap cards. There's actually fillable PDFs that you can print off and enter your own information once you start hosting a class. But if there's anything that you need that you don't see on there, just reach out and let me know. I'm happy to help.
So this question might be for Jane a little bit too. If people go ahead and start doing that before we have the grant funding, Jane, is it something where they should track their hours and document what class they've started so that they could then possibly, we could count that toward the grant work? Or is that jumping ahead too much?
That's a good question. Let me think about it. I'll look back to, we also have to, as Deanna's alluding to, report on some measures. And I don't think it hurts, certainly, if folks are starting to do it now, and then we can decide how it might roll up into the reporting structure. But
Jane, once you figure out what measures there are, let me know, because if you are doing any of these workshops, we already have to capture a ton of data anyway, and we'd be happy to share it. Yeah,
that's awesome, Melissa. And our metrics are pretty straightforward, more process measures to begin with, but I can certainly share those. I think we're just looking at sort of volume data to begin with, and where, how, and numbers really to see how the programs are being taken up.
Gotcha.
Other questions for Melissa?
Deanna, I can share with you the PowerPoint, the link to the video, and my contact information. So if anybody has any questions after the fact, I know I'm always somebody that an hour later I'll think, oh, I should have asked this, but feel free to reach out. I'm more than happy to help.
Great. I'll share that with the mailing list when we send out the follow-up from this meeting. And that slide that included the regional contacts is part of that. So that's great too. Yeah, perfect. Thank you so much for being here.
Thank you for having me.
Yeah.
If you don't all need me, I'm gonna actually head off because I'm supposed to have open office hours right now for those regional coordinators, and somebody else is filling in. So thank you so much for having me. It was nice to see you all.
Yeah, thank you, Melissa.
Bye.
I think one thing that we didn't mention, either Jane or I, there are other evidence-based programs besides these, the ones through the My Healthy VT, that could be applied toward the grant. Specifically, Tai Chi for arthritis was talked about. So growing existing programs and expanding for other programs related to Tai Chi would be part of that process. And then there are a few others that we've talked about as well for hosting on-site program or virtual, a hybrid type of thing. So not just limited to those, but those are certainly the easiest ones that are already out there and we were really excited about. All right, any other questions on any of that before we move on? Okay, so the steering committee and I were talking this past week about how we could make the best use of the roundtable time. And they suggested that I put out a question ahead of time, which I put on the agenda to share one favorite program or idea happening now or being planned for Senior Center Month, which is coming up right away in September. So when we go around, if you'd introduce yourself and say where you're from and share, if you'd like, some type of exciting or just program that you're working on that people are enjoying and anything you're planning for Senior Center Month. And we have such a small group today that probably everyone can go and we'll be quick.
I'll go first. Something I wasn't exactly expecting people to enjoy quite so much, but they really have been. We partnered up with the former chaplain from the Dartmouth Hospital, who also does some work with the Aging Resource Center at Dartmouth. And she came in to do basically a series of seminars on listening skills and communication skills. And the people that are participating in it just can't get enough of it. And so that's been going really, really well. We don't have anything specific planned for Senior Center Month yet, but I think we're going to be continuing pickleball. This is our first foray into the world of pickleball, and I'm sure many other centers know just how popular that is. So.
Deanna, this is Melinda. I can go next.
Thank you.
So I actually stole your idea, Deanna, and I got a hold of that beyonder.com, and we're going to start that in September. So we're going to do that, once a month for 6 months. And so we're really excited about that. And in the meantime, we've started up, we used to have music once a month, and we just started that back up last month. And, just trying to get back to a few of our normal things that we used to do. So we have some other ideas that we don't do so much in the summer, just because it's so short and people are usually busy. So just working on trying to get things lined up for the fall winter season.
Great. Thank you, Melinda, up in the Northeast Kingdom there. Who else would like to share? Sarah?
Sure, I can share. So in Montpelier, we have it's happening right now outside my window. We have a new weekly farm stand that's happening on Wednesdays from 1 to 3. It's every week, and we got not only some support from CVCOA, but also through a grant from AARP. And so we're having events as part of the farm stand, and the farm stand itself is selling very cheap, $1 for a thing of mint, $2 for a little thing of strawberries. I did some shopping. And so it's from the Feast Farm, actually, that is run by the Parks Department, that is about 2 miles away. And so we're selling our own produce really, really cheaply. So it's senior focused, but anyone can come by and pick up some produce. And then we have a whole lineup of events that are happening, anything from live music. Right now there's a cooking demo happening with some of the produce. There's poetry readings and talks and presentations, and it's all outside. So it's sort of safe for people to come by. A lot of the events are drop-in style, and I think today's our 4th one. So we're still kind of in the early days, but it's been growing steadily, and we're going to continue into October. So as long as we have fresh produce to offer out there. So we're pretty excited about that, because it feels like it's something that actually can bring the community together in a different way.
That's awesome. Very cool. Who else has something to share? Andrea?
I'm Andrea from the Heineberg Center in Burlington, and piggybacking on Sarah in terms of farm and produce. Our folks are really excited. I wrote a grant to the food bank for a large farm share from the Intervale for this season, and then we'll have one for the winter season as well. And we're also participating in their gleaning project. So the produce is just overflowing. You know, our board president picked up our farm share yesterday, and she was texting me at home like, I can't believe how much food this is. And it's almost all gone this morning. You know, it's people are so excited to have fresh organic produce for free. And, you know, I think at the time that I wrote that proposal, I didn't really know how much more free food was going to mean than it does right now with prices the way they are. But we are distributing a lot of food, and it feels really good. And people are really happy about it, especially cucumbers.
That's awesome. Who else would like to share? Hi, Carrie.
Hi. So we also have started our farmers markets up once a week. We receive the Vermonters Feeding Vermonters grant. So we go to our local farms, get supplies, set them out farmers market style so that the seniors in our community can come shop for free once a week. We're getting excited as we get more items from the farms. The produce is starting to come in. So that's been nice. We also have a beach day planned, some musicians coming in soon. And we're going to be breaking ground this month on our pavilion and walking paths. So a lot of exciting things happening.
That's cool. I hope you'll share pictures. We've heard about the walking paths before, and I'd love to see progress as that happens. That's exciting.
Carrie, can I just ask, can you describe the pavilion a little bit more? I haven't been around to hear about it, so.
No, I'm not too familiar with the exact design. I think it's a 30 by 40 foot pavilion that we've gone with. And then we have the rubberized walking track around it that eventually will have the exercise stations at it. But the pavilion should be, it's going to have electricity and the cement pad and everything. So.
Did you end up getting, or are you planning to have outside exercise equipment? I think I'd heard about that at one point. Were you able to do that as part of this project?
That's in another grant that's in the works, so it's looking pretty promising.
Neat. I don't know if anyone had a chance to see the 3-minute virtual sort of tour of the Vermont Senior Centers, but there was some cool pictures of the Castleton outside exercise equipment and from lots of places around the state. But if you hadn't sent pictures to the shared file that I used to make that video, still please do that, and I'll add your pictures to the next version of that video. That'll maybe get better as I get better making videos. So please send them and I'll perfect that over time. Let's see, who haven't we heard from? Rebecca, maybe?
Geez, I guess I'm getting put on the spot, huh? Let's see. So something that's exciting. Well, I've been bringing in some musicians lately. One of our seniors came in today and played the harp during a lunch. And a couple weeks ago, we had a alumni group from Johnson State College that one of our seniors is part of. They were here from out of town, and they all came in, about 15 of them, and sang a cappella. So yeah, we're kind of in the slow right now because it is summer and people are out and about, but they're mostly here for lunch and exercises at the moment.
Cool. Thank you for letting me put you on the spot. I know Cynthia doesn't have a microphone. How about Maureen and Waterbury? Is there, if you'd like to share, or anyone else that hasn't shared yet?
Hi, this is Maureen. I don't really have anything to share. We're just same thing, just feeding people. We have some exercise classes. I apologize, my camera's not working on my computer, so just summertime, just trying to keep going. I love all the CSA ideas. I wish we had done something like that sooner. So we do get a lot of free produce from the gleaning, the community harvest that we use, but it'd be nice to have something for the seniors to to share. That would be really good. So I'll take notes for next year.
Good. Thank you, Maureen. And that's part of what the grant that Jane mentioned might be able to bring to even more centers as well. So lots in the works on that. And then if anyone else hasn't spoken up that would like to, please do. I have just another quick announcement for VASCAMP. Oh, I didn't give an announcement about Woodstock. We are moving along here. Everything seems to be going pretty well. This week we had our chief of police came in and spoke and had a great audience. I was actually surprised how many people came. It's something we're going to try to do quarterly, the chat with the chief. And people had great questions, and I think it just helped them feel, safer and connected. We had a shooting in Woodstock, if you saw it on the news within the last month, which was pretty traumatic. And one of our, some of our folks live very near to that. So it was really good timing, but lots of good information shared there. And for Senior Center Month, we're planning our big annual barbecue. We have music outdoors, and we have people come for a chicken barbecue, and lots of things related to that, door prizes and outdoor games, that kind of thing. But that's the main thing we do for Senior Center Month here in Woodstock. The announcement that I have to share came from, and for some reason it wouldn't copy and paste into the chat. It's about getting rid of old medications and the drug disposal, prescription drug disposal, through the Division of Substance Use through the Vermont Department of Health. And I'll send the contact link out for that. They have some bags, it sounds like, that can be made available to mail drugs back if there's not a free disposal site near you. But I'll share that information when I do the follow-up. Are there any other announcements or any sharing that people would like to do before we wrap up today? Andrea?
So my personal and work life have kind of come crashing together. My father's been hospitalized and is now in rehab, and it's going to be a long process. So that's been going on the last 3 weeks or so. And I think that a couple of things. One is I became aware of how much I didn't know and how difficult it is to learn those things when you're at a point of crisis or challenge. And so I really have a lot of energy around developing, hosting workshops for both our participants and their families around planning for health emergencies and end of life thinking. And that, I think, is the other piece, is that I'm usually very focused on supporting people's living and their activity. And I have now this sort of parallel, real deep focus on the process of death and dying, and thinking about how to surface that in ways that are helpful to the community, but really addressing those issues. And so I just wanted to put that out there. I'm open to any resources people have to share around those ideas, and I'm sure we'll have more coming in the coming year.
I'm so glad you brought that up. It is so important. I think we, over the last couple of years, and I think Montpelier has taken a similar approach, to an age well, aging at home support type of program. We modeled ours around the village to village network model. And then we've developed as part of that an age well series of workshops, and we started with, and they're really purposely sequential, but you know, aging at home versus moving, you know, home to long-term care type of transition, and what goes into that process and that thinking, and how do you pay for it, and then the next, and we bring in experts, you know, panel experts, and then the next one was how to hire a caregiver, and then home modifications, and we had AARP come present on home fit, and we had local emergency services talk about fall prevention and things like that. And then we had one on, the next one was downsizing and decluttering, which is, you know, all part of this process. And then we've had green burials and funeral, you know, planning, doing legacy letters was another one. And that's a great way to have families talk about it. And what else? And we've had VNH and Bayada do a talk together on hospice, and they're a great resource for those types of programs and support. So that's what we've done here.
That sounds great. I would love if you could send me kind of your outline of sessions. And I know I spoke actually this morning with Carrie Batras from Age Well about bringing in some folks from that organization to help us. So thank you.
Yeah. Jane?
Thanks, Deanna. I just wanted to add, Andrea, too, as you're thinking about some of those series, advanced directives are a really good one. As a clinician, I think it's so important to make sure that things like advanced directives are sort of thought through and discussed. There's some great resources at the Vermont Ethics Network. So Cindy Bruzzese, who is in Burlington, does a great job and sort of ties the advanced directives also to hospice and other end of life kinds of discussions. So it's all part of the continuum, as we know, but she's a great resource, and we can also help connect if that's helpful.
It is helpful, and thank you.
Other announcements or sharing anyone like to do?
Deanna, did we decide whether we were meeting in August or were we skipping August?
Oh, thank you. No, we didn't. I was going to put up a poll. We have a smaller.
Oh, that's right.
Let's see if I can quickly create a poll. I don't know that I can.
Well, or you can just have people raise their hand if they yes or no.
So some years in the last 3 years that we've been doing this faithfully now, we've taken the month of August off because of vacations and that kind of thing. I think July was pretty small group, and maybe that's why anyway. But how do people feel about an August meeting? Should we take the month of August off and reconvene in September? Who would be in favor of taking the month of August off? Rebecca, Sarah, yes. Mark?
I'll be at Scout Camp.
Okay, you'll be at Scout Camp. Okay.
Scout Camp. Two different ones, Cub Scouts and Boy Scouts.
All right.
Deanna, the only thing with taking August off is would be no time to really think about September if there's going to be any big events, but maybe you could do that via email. I don't know.
And contracts, right? Contracts go out.
Yeah. I agree. I think we could try to postpone it and just handle it over email. It seems like maybe we wouldn't have as good of an attendance. I'm not sure. Is anyone really opposed to that and just want to have a meeting? You're going to facilitate if you do. Okay, well then let's reconvene in September. We'll still email in August. We'll let people know that there wouldn't be a meeting. Herb, go ahead.
I have a question. Did the AAAs already give their report? And I guess they did, probably. up
No,
front,
we
right?
didn't actually.
Oh, okay.
Please go for it. What?
Well, I was just actually up in Newport Derby area. We have a new provider that just started. It's actually a restaurant. So that's something that I was working, and I was so happy to facilitate that because one of our other providers needed 2 months off at least. So the timing was perfect. I love when things work out like that. Our West Burke site, our site manager, Bob Therio, he gave his notice and he had his last day last Friday. So they're currently seeking a site manager. If you know anybody in the Northeast Kingdom who has a burning desire to run a meal site. So, and as I mentioned, we're already kind of eyeing, planning out the contracts and seeing where that's going to fall, because wouldn't you know it, I've almost been here a year. It's close to it. I mean, so that's basically my report in a nutshell. Thank you.
Thank you. You've been a very nice addition to these meetings and that last year, and always willing to speak up. That's appreciated. Kim or Wendy or Chris?
I'm not sure I have much updates, but we are, moving along with grab and goes and sit down meals and some events in Chittenden, Franklin, Addison, and Grand Isle. We've had some really good feedback from our Meals on Wheels satisfaction survey, and we've just sent out a grab and go survey. So anyone who is participating, Andrea or Rebecca, you might hear people got a survey in the mail, and that's the grab and go satisfaction survey, just to learn a little bit about how they're feeling about that program. We also included in that a little insert that just says, if you want to make a donation to help support sustaining this program going forward, to include it. So that it was not a bill or anything like that. It was just saying, hey, if you want to make that donation, we'd be happy to receive it and help continue the program. So that went out to about 1,200 people about 10 days ago. So people are returning those now. Andrea, I see you nodding, and Rebecca, so maybe you've heard it, that it's out there. The last thing that we'll be doing before the end of our fiscal year, which is September 30th, is do sort of a mini survey for congregate meal sites. So any participating just in the meal site portion of our programming, we'll be looking for those. Thanks.
And I guess down here, we've been working on our budgets, as I know we all have. Happiness. And we are planning a wellness benefits fair to be held in Ludlow on August 5th. We have about 20 different vendors coming. Trio is going to provide a barbecue for us. So if you're in the area between 11 and 2 on August 5th, we would love to see you. That's it for me.
Okay. I can go next. We're Central Vermont Council on Aging, and first I want to say that we're trying to hire a wellness coordinator if anyone has any leads. It's a 30 to 40 hour position with flexibility in hours. Also, we're taking steps towards having our meal sites provide therapeutic meals, beginning with a diabetic meal. So we're putting together some training resources for that. But that's mainly what I'm focusing on lately.
Very good. Thank you for sharing. Is that something that other regions might be thinking on the radar in the future, or can anyone speak to that?
Yeah, all of the AAAs have been working with their programs to offer therapeutic diets at some level. Obviously, you've all heard what AgeWell's doing, so we already have that ability, and I think that others are working at their own levels to incorporate therapeutics soon.
Right now, my present concern is capacity in the northern tier. So, I mean, that's an ongoing thing. I bring it up all the time. So that's why I was up there. So we aren't currently on a waiting list, but we are very, very close. And I've had to reach out to Mary Woodruff about that. So we've been conversing about a letter that went out actually today, you know, as we try to draw back the numbers from COVID, you know, make sure that everybody that's on Meals on Wheels needs to be receiving home delivered meals. So we're working on therapeutic meals. I have 3 sites I'm working with. Unfortunately, one of those, the site manager just just resigned. So we're pressing forward on that as well.
Thanks for sharing. All right. Anyone else that we haven't heard from that would like to share before we go?
Can I jump in for a moment?
Absolutely, Heather.
Hi, I'm Heather. I am a nursing student right now. I work at the University of Vermont Medical Center as a pre-op nurse, but I'm getting my BSN. And so one of my topics for my field experience in my program is, oh, I'm sorry, not topics. One of my, what is that called? In order to graduate, one of my requirements, there it is to pick a topic. And one of my topics is preventing social isolation in older adults. So I just wanted to say, I am learning so much about what you all are doing. I'm in Chittenden County, so I've only been in the Burlington to like Colchester, Winooski kind of area. But I just want to say, keep up the good work. There's so many amazing things you guys are doing, and I really appreciate it. And thank you for giving me the opportunity to be part of this. So
thank you for your interest, and thanks for joining us, Heather. I think we're right at time, and I think we've heard from everyone in some capacity. So I can't thank you enough for your input today and your time. And I'll send out a notice to the whole group, but we'll see you in September. Thank you all. Enjoy the rest of your summer.